This is the Emergency Medical Minute, sponsored by Health One. So one of the things that people wanted to know about is vertigo versus stroke, right? So and really it's easy, like when people come in and they say dizzy and they actually feel like they're off balance, right? There's a few things that you should just put in your back pocket to evaluate those patients. First, vertigo and stroke vertigo is either peripheral, meaning it's related to your ear, or it's central, meaning it's related to your brain, okay? So the first thing that should give you pause is if the person can't walk, really has difficulty with controlling their trunk, then it's usually a stroke. And in the cerebellum, which is the part that controls your balance, it really aligns well where if, for example, you have a stroke in the lateral part of your cerebellum, then usually you'll get ataxia in your limbs. Whereas if you have a stroke that's in the center of your cerebellum, then usually you'll ask people to sit up and they'll just start going like this and they'll start falling over. So the reason why we care so much about cerebellar stroke versus of course, vertigo is one, you don't like to miss strokes. But two, if people have large strokes, then you can actually have enough swelling in your cerebellum to compress your brainstem and people can actually die. So sometimes you have some really bad outcomes associated with these. Besides kind of that ataxia thing, that other kind of neurologic deficits mean that it's a stroke. So if a person has numbness or weakness to their face or have, difficulty swallowing, those are obvious things that say that this person has a stroke and not ataxia. Stroke also, the onset, with our stroke people who we see here, it's very sudden usually. So it's usually people are feeling fine and then boom, they're super dizzy. Whereas some of the more peripheral vertigos will be associated sometimes with a slower onset or things like tinnitus or other things. At the end of the day, it's a very difficult diagnosis, and even honed clinicians, like yourselves and our docs, oftentimes will need neuroimaging to figure it out. And the neuroimaging of choice is a MRI because the cerebellum is encased in bone, and that encasement in bone makes it harder to sometimes see a stroke. So a quick ditty on vertigo. We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.